The learning objectives are similar, but not as well defined as in part 1. So we will review health, illness, disease, certain models of health, epidemiology, dimensions of health, social cultural factors in healthcare, the experience of being a patient, looking at social aspects of care, and discussing the quality of life and its termination. These are aspects that will probably be covered more specifically in your final exam. As we discussed previously, the concept of health is confusing because everybody has a different view on it, including you. So this includes biomedical scientists, social scientists, healthcare administrators, and ecologists, and nurses. Health, the concept is different for everybody. And as indicated, it's not appreciated until you become sick. There are evolving healthcare concepts, and they've evolved over centuries, whether it's from an individual perspective or to a global perspective, which is very, very valid now with our pandemic. Health, according to the World Health Organization, was a state of complete physical, mental, and social well-being, not merely the absence of disease. And health, according to the World Health Organization, involves emotional and psychological wellness, not just efficient and properly functioning body systems. Wellness was defined in 2020 as an active process of becoming aware and making choices towards healthy and a healthy, fulfilling life. And it involves physical, mental, spiritual, emotional, social, and environmental aspects. The dimensions of health include the physical, emotional, spiritual, intellectual, environmental, and social, as just mentioned. Dimensions of health, if we look at it specifically, physical is to do with good nutrition, regular exercise, avoiding harmful or risk behaviours and habits, seeking medical assistance when required. It involves emotional aspects, to understand your own feelings, accept your limitations, be positive. And in that way, you may have emotional comfort and stability. Think of spiritual aspects, and these deal with morals, ethics, values, and they give meaning to life. Other dimensions of health include the intellectual, constantly learning, problem solving, being creative within yourself and the world around you. Environmental reflects your personal health, because if the planet isn't healthy, you're not going to be healthy. If there's pollution everywhere, you're going to be affected. If you've got smog as a result of air pollution, your health is going to be affected. From a social aspect, it's important to relate well to others, whether it's within the family unit or outside the family unit. All these dimensions of health affect your health. The models of health that we will briefly review are the biopsychosocial model, the holistic model, the holistic nursing model, and the health and illness continuum model. The biopsychosocial health model defines health as a state of complete physical, mental, and social well-being, not just the absence of disease. It's influenced by social factors, psychological factors, and biological factors. It also incorporates cultural, economic and political factors, which concern most people. An example of the bio-psychosocial health model is a biological condition such as a workplace injury, which requires long-term pain management. And this can easily result in a life-changing situation. By taking painkillers constantly, you could become addicted. The holistic model of health emphasises promotion and protection of health. It's about well-being of the person as a whole, and it recognises social, economic, political, environmental influences which affect your health. The holistic nursing health model is defined as all nursing practices that have a healing effect on the whole person. And this leads the nurse, you, to a greater awareness of interconnectedness of yourself, others, nature, spirit, and relationships that promote optimal health. Then you've got disease and illness. Disease is defined as a physical or mental disturbance involving symptoms, dysfunction, and or tissue damage, and usually causes illness. Though one can have an illness without having a disease. One can have a disease without having an illness. For example, you can have diabetes mellitus and be positive and not be feeling ill. However, you can constantly feel ill without actually having a disease. It all depends on your perception, your attitude. Illness or sickness is more subjective, and it's about the personal experience. As we mentioned previously, with our student example, you can have a student, for example, or you can have a person that's got a disease. They may have renal disease. They may have cardiac disease. They may have an endocrine disorder. However, they still go to school, they still go to work, they still function. Illness or sickness is subjective. It's good to be positive. What are some examples of common illnesses? We've discussed this before. Common illnesses could be allergies, a cold, a sore throat, a headache, a stomach ache, diarrhea, etc. Diseases can be examples such as SARS, sickle cell anemia, diabetes mellitus. They can be communicable or they can be non-communicable. Communicable, you're looking at COVID-19. Non-communicable, you're looking at heart disease. Then we look at the epidemiology of disease. And as we mentioned previously, epidemiology is a method that's used to find causes for health outcomes and diseases in populations. And epidemiologists, they look at the patient as the community, not as an individual. The patient, the community, is viewed collectively. And the objectives of epidemiology are to identify the etiology or the cause of the disease, and to determine the extent of the disease, the progression of the disease, and evaluate preventative and therapeutic measures for the disease or the condition, and then develop public health policy, which is very much in the forefront currently for our pandemic globally. The 5 W's for epidemiology are diagnosis, what? is the health event. The person, who it affects, the place, where it happened, the time, when it happened, and why and how, the causes, risk factors and modes of transmission. Epidemiologists look at risk factors. And a risk factor is something that increases a person's chance of developing a disease. So if you're a smoker of cigarettes or tobacco, you may be at risk of developing cardiovascular or a pulmonary disease. If you drink alcohol or too much alcohol, this can put you at risk of developing liver cirrhosis. If you have nutritional choices that are unhealthy, then you could become obese or morbidly obese or hypercholesterolemic, high triglycerides, and develop cardiovascular disease, have a stroke, a heart attack, renal disease, peripheral vascular disease. Physical inactivity is seen as a risk factor. Sedentary lifestyle, which could result in developing obesity again and all the associated problems. Spending too much time in the sun without proper UV protection, skin cancer. Not having certain vaccinations. Well, your children primarily. And as a consequence of that, they could develop polio or tuberculosis. Unprotected sex. This can result in developing diseases such as HIV, AIDS, sexually transmitted diseases like syphilis, gonorrhea, herpes. Epidemiologists look at disease prevention, and they've identified 4 levels of disease prevention: primordial, primary, secondary and tertiary. Primordial is a new concept, and this is to prevent the development of risk factors. And this deals with primarily lifestyle modification, which people don't want to be involved in. It's hard work, lifestyle modification. Eating the right food, having the right habits, not participating in risk behaviours like smoking, exercising, hard work. Alternative therapies, don't believe in them. Naturopathy, maybe don't believe in them. Chinese medicine, maybe don't believe in them. Yoga, hard work. So primordial prevention deals with lifestyle modification. Then you've got primary prevention. This is health promotion, education, nutritional interventions, lifestyle behavioural changes, regular exercise. It's an extension of primordial. And this deals with specific procedures such as immunisation, a green planet, which means pollution-free environment, noise pollution control, chemoprophylaxis, maybe nutritional supplements. Secondary prevention deals with early diagnosis. You've got the problem, but you went to see the doctor, you got early treatment, and you prevent provincial complications. And this deals with regular health checks, which children, elderly, maybe pregnant women would obtain. High risk groups are considered to be the obese or the morbidly obese, smokers, alcoholics, and those who have a sedentary lifestyle. Then you've got tertiary prevention. Well, you've got the problem. And this is about disability, limitations and rehabilitation. And depending on the nature and the extent of the disability, which could be physical or mental, the main objective is to promote productivity, positive thoughts, improve mobility, have physical therapy, exercise, occupational therapy, and if necessary, corrective surgery. Common diseases in Malaysia, you know them. This could be dengue fever, tuberculosis, hand, foot and mouth disease, food poisoning, viral hepatitis. Other infectious diseases include measles, leptospirosis, malaria, Japanese encephalitis, and typhoid. So, how do we prevent the spread of disease? And you're doing it all now. These are things that we should do all the time, not just as healthcare providers, but in the general public. We should be using universal precautions. Think of what they are and what you're doing now. Hand hygiene, cough etiquette, disposing of contaminated items effectively, physical isolation, which basically means don't share food products, don't share your personal items, cross-infection. Always practice hand hygiene, whether it's hand washing or whether it's hand hygiene using gel. Be aware of what the 5 moments of hand hygiene are. If you're sick, don't go to work, don't go to school, stay at home. If you're really that sick, go and see the doctor. To be an effective nurse, you've got to understand how you think, how people think about health and illness. To be an effective nurse, you've got to have behaviours and habits that influence people to want to practice health. To be an effective nurse, you've got to know how actions regarding healthcare are perceived by the community. I mean, if people don't believe in doctors, conventional, Chinese medicine, naturopathy, traditional medicine, then it's not going to work. To be an effective nurse, you've got to understand culture, environment, the economy, the politics, because they all affect health, as you are very much aware. What are some of the socio-cultural influences on health? Well, disease, for one. Risk-taking behaviours. The effectiveness of healthcare promotion efforts. Access to healthcare. Availability of healthcare. Access and availability of quality healthcare. Why is that important? Because all of these have an effect on how health is perceived and how healthcare is perceived. If you don't know anything about disease, you're going to be at risk. If you don't know that smoking, alcohol, taking drugs which are not prescribed are risk-taking behaviours. If you don't understand why the government or healthcare providers are promoting healthcare efforts, you're not going to be involved, and therefore your health will be affected. If you don't have healthcare access because you're out in the kampong and there are no facilities and you don't have access to get to facilities, it's going to affect your healthcare. It's going to affect your health. If you don't understand that there are different levels of healthcare available that you may have access to, quality healthcare, then this is going to affect your health. and your healthcare. Some of the social factors that affect health are you educated? Do you have the resources? Your occupation, ethnicity, race, religion, political affiliations, and your geographic locations. Think about why they may affect your health and healthcare, and more importantly, the healthcare of your family, or the healthcare of your friends, or the healthcare of the community. Think back again. As a child, you became sick. What was your family's view about taking care of you? Did they take care of you? Or did you go to the doctor? Or did you go to the clinic? Consider foods that were good for you. Vegetables versus a Big Mac. Think about when you had a fever and how it was treated. Was it treated? Consider what was sick enough not to go to school or not to go to work. And think about your family's view about going to a conventional doctor. Think about something about your health when you were growing up that changed when you commenced nursing as a career. Then let's look at the social inequalities in health. Culture and social well-being are not the same thing. There can be many different cultures within a society, but social inequalities are generic across all cultures. And as Maslow's hierarchy of needs highlights, all human beings need food, clothing, shelter, a happy environment, and to be loved. Access to these needs impact on health. So think about it. Do Malaysians or people in general delay or avoid seeking healthcare or medical treatment? Yes, maybe, no. Well, indecision about healthcare across all cultures and societies are sometimes related to phobias about doctors, about hospitals, about nurses, about healthcare. People may be poor, they don't have the income, they don't have the resources, or they live in the middle of nowhere and healthcare is inaccessible. They may have traditional beliefs which relate to not going to conventional medical practitioners, or people just believe they're too busy, no time, or they're influenced by significant others like their grandmother, their grandfather, their mother, people in the community such as the tribal elder, or they have self-doubts about what can be done for them. Other factors that may involve indecision about healthcare could include their age, gender, and genetic makeup. What are some of the social healthcare issues? Well, they relate to care of the mentally ill, and there are issues of concern. There's a social stigma. These people have a negative self-image, and as a consequence of how society feels about them, they have low self-esteem. And this could impact on issues such as alcohol or substance abuse, misuse, But the important thing is to provide sensitive, patient-centred care and access to mental health specialists and professionals. Everybody gets older, and in conjunction with that, they may become chronically ill. But you don't have to be old to be chronically ill. You could be born with a condition such as a renal problem, and as a consequence of that, you are in renal insufficiency, may eventually go into renal failure. Chronic disease affects every aspect of a person's life. It impacts on their physical, mental, family, social, financial, and employment. And ultimately, chronic illness typically shortens a person's life. Again, management is related to providing sensitive, patient-centred care and consultation with healthcare professionals such as yourself. Everybody gets old, and as a consequence of that, getting old, you may develop chronic illnesses which deal with mental illness such as dementia or Alzheimer's. There's hearing impairment, defective vision. You may become hypertensive, develop diabetes mellitus, a pulmonary problem, heart disease. The important thing is to provide for these people, if you're the caring nurse, a positive environment, encourage social interaction, provide patient-centred care, and again consult with knowledgeable healthcare practitioners. The ultimate is the end of life, and there may be lots and lots of issues as you head towards the end of your life. And it doesn't have to be elderly. You may be young with a terminal condition. You could be a child with a terminal condition. The issues of concern revolve around moral and ethical dilemmas, quality of life, which reflect your personal values and beliefs. There's always the fear of the unknown. Am I going to suffer? Am I going to be in pain? Who's going to look after my mother, my wife, my children? And what happens to me after I die? Management seems to be related to 4 areas of concern: physical comfort, mental and emotional needs, spiritual issues, and practical tasks. Who's going to do what after or during? Think, has anyone ever been a patient or had a family member or a friend that was a patient? You're not going to be able to share it, or you could share it if you wanted to on eLeap in feedback. You could share a positive experience or a negative experience. Or name a potential positive or negative patient experience. I could give you countless. It's important to understand the patient's experience. All patients will be anxious, fearful, undergo what they consider embarrassing procedures. When they come into hospital or even into the clinic, there's an invasion of privacy, feeling depersonalised with a loss of identity. They take away your belongings, hospital provision. A lot of patients feel alone and lost. Think of yourself. Do you really want to be a patient? Do you really want to be admitted into hospital as a patient? From my perspective, I don't want to be a patient unless I absolutely have to. And if I do have to be admitted into the hospital because I have a serious condition, I'm happy to be there. But I hope that you know what you're doing. I hope, more importantly, that you care about what you're doing. I hope even more importantly that you care about me as a patient when I come into your hospital, and that I'm not an inconvenience, and that I'm treated like a person who shouldn't be there. So your role as a nurse in healthcare is to be a patient advocate and care about all people from all ethnic origins, religious backgrounds, and support them through health and illness. You're responsible for providing holistic care, which deals with the physical, the psychosocial, the cultural, emotional, and the spiritual. Just think, do people who require healthcare really need a patient advocate? Yes or no? Think about why. From my perspective, everybody needs to have an advocate, especially in a hospital. Even if you're reasonably healthy, in comparison to being really, really sick, because the patient doesn't want you to give them the wrong medication error. The patient doesn't want to acquire a hospital-associated infection because you didn't do hand hygiene. The patient doesn't want to have wrong site procedure or surgery because you didn't identify them correctly. All people need a patient advocate. So in summary, health involves emotional and psychological wellness, not just efficient and proper functioning of the body. There are dimensions of health that you need to consider, and consider holistic nursing. The primary role of the nurse is to be a patient advocate. And as the World Health Organization stated, health is a state of complete physical, mental and social well-being, and not just merely the absence of disease or infirmity according to the biomedical model. Thanks everybody, that's the end of this session. If you've enjoyed it, please recommend it to your colleagues, your friends, and check out some of the other Dr. Manny Learnshops on YouTube. Bye for now.